Okay, I'm going to talk about scleroderma. I must admit, when I looked into scleroderma, I found it a bit strange. They talk about this being a very rare condition, but as you look into this, you realise it's not quite as rare as they think it is, or they are declaring it is. So, scleroderma is a systematic sclerosis, which I found really weird thing for them to say, and but it is an autoimmune disease, and it does affect your skin. It makes it all nice, all tight and hard, and not very nice. But it can affect things like your blood vessels, your digestive tract, and some of your internal organs. There are three different variations of this condition, and each one has its own issues and problems. Now, I found this information in lots of different places and not in the right order. So there are three different variations of this. You've got the limited, the diffused, and the localized. Okay. Now, they are different, all of them, but the localized has another name. It can be referred to as a morphia, okay, because it does only affect your skin. Why they call it morphia, I have no idea. I just haven't got a clue. Just whatever. Don't even. Not interested. But the diffused is one of the most serious. The diffused, from what I gathered, from what I can find, I mean, one of the first description they give of diffuse when they talked about these three categories to begin with was it affects your heart and your organs, and you just think that's a big step forward from just your skin. And they don't even give an explanation of the limited. When you first sort of come across these three things, you just think, what? Oh, are you talking to us? Okay, right, fine. Okay. So you get a pretty clear picture of the fact that if you get the localized version, it's going to be pretty mild compared to the others. Okay. But there is no cure. Regardless of anything and everything, there is no cure to this condition. Okay. Now, scleroderma itself is an overproduction of collagen. Now, collagen, most people have heard of it one way or another. Collagen is a protein. It's a fibre that your body makes. Most people know of it as a skin thing. It's what makes your skin. It's what keeps your skin looking nice and youthful, and holds everything in place. It stops the wrinkles and stops everything from sagging. And as we all get older, the collagen becomes less effective. It gets weaker, which is why us women start sagging and everybody starts to wrinkle, And I know a lot of women like to use collagen including me, in certain areas to help sort of delay the process a little bit, But I never considered collagen an internal thing. I thought it was a skin thing, so that it was more to do with, it helps your skin. The collagen was a skin builder. It's something that protected your skin. It was something that you had, rather than, it's something that bonds and builds your skin. Not something that bonds and builds your internal organs as well. But apparently it does. And then I felt a bit stupid because I think, should have known that. Duh. But scleroderma means you have an overproduction of collagen. Okay. So, although again it's not 100% certain as to why this happens, they do think, or they do know that your body's immune system does play a part in this, but it is a combination of factors, including your immune system. There could be a genetic or environmental trigger. Now, they say that there could be environmental triggers, but get this right, even though they have a list of environmental triggers such as exposure to viruses, medications, drugs, even if you work with harmful substances or chemicals or toxins, this could be a reason or a cause to get it. They have never actually identified anybody with scleroderma as having a environmental cause for it, or very rarely identified anybody who's ever got scleroderma as having an environmental cause for having it. It's a rare thing, if that happens at all. So despite their environmental triggers, it's one of the rarest reasons of entire cause for, the rarest cause for it. Yeah. It is far more common for you to have a genetic factor, and although I couldn't find it, they do believe that this genetic factor, although doesn't always run through families or even through some ethnic groups, anyone can get it. It's a genetic variation. There is a genetic variation. I just could not find it for the love of me. I just couldn't. But the immune reasons, people are most at risk for this if they have things like lupus, rheumatoid arthritis. But if you have something like, if you have Sjogren's syndrome, 20% of people with Sjogren's have scleroderma, which I found really interesting purely because when I looked into Sjogren's, scleroderma wasn't even on, from what I can remember, scleroderma wasn't even on the list. And yet, 20% of people with Sjogren's have scleroderma. And it's the same with Raynaud's. I mean, I've not looked into Raynaud's, so yeah. But 10% of people with Raynaud's will develop scleroderma. So an immune factor is one of the biggest risk factors for people. So if you have Sjogren's, Raynaud's, or even lupus or rheumatoid arthritis, then you are at much higher risk of having scleroderma. Or vice versa, already have it and then risk one of these. You know, but yeah. Also, I did find later on, as I was sort of finding things, scleroderma is actually far more common in women than it is in men. And between the ages of 35 and 55. So there is an age kind of thing with this as well. And although anyone can get it, it is more common for women than men. But there is a paediatric version of this. Now, there's no age for this paediatric version, but if you're looking at a paediatric version, I suppose it depends on where you come from, depends on where that paediatric age ends. But depending on which doctor you're going to, depends on where that paediatric ends anyway, because it could be, as I say, my son was under paediatrics from a very young age. He, till he was 13, and then he had to stop seeing a paediatric doctor because he was too old, and then he had to see paediatric specialists for other issues. So he was under paediatrics once he was born, but once he turned 13, he was no longer under that paediatric because he, so it just depends on the doctors as well. Most paediatrics say until they're 18, some say 16, but some say until they turn 13. It just depends on where you live, it depends on the doctor. Yeah, but here in England it's usually till they're 18, but some say 16. My doctor turned around and said he didn't need him anymore when he was 13. So, you know, that was him. You know, he wasn't needed at the age of 13. He didn't need him anymore. You know, but if you're saying paediatric, it could be any age. Yeah, it's weird. So, yeah, it is strange. Also, for something that is pretty rare, in America alone, I could not find the world, like the whole world, like statistics on this. In America alone, 250 people out of every million, will get this. So, per million Americans, 250 people will get this. That's just in America. I could not find the statistics of the world. And that is insane. That really is insane. It's not that rare, realistically. Like, the types. Now, although when I was researching this, it kept telling me there were two main types. There were two main types because there are two most common types. But there are actually three types, okay? Purely because the third type, when I actually really got into this, the third type isn't actually classed as, they don't really class it as scleroderma too much, although it is a scleroderma, it has another name. Okay, so we shall do this. Okay, so if we start with the most common, we have localized scleroderma. It is the most common and it does only affect your skin. It just does. And generally, it won't even affect the whole of your skin. It affects your fingers, your hands and your arms, and your legs and your feet. It thickens the skin, makes it really tight. It makes it waxy. The skin becomes really waxy and patchy. Or if it doesn't do that, it will still thicken the skin, but it becomes streaks rather than waxy. If it isn't really severe, it can go away all on its own, which is strange for scleroderma. Or it can just even out, so it will just become really thick, patchy or wavy or whatever, and it will just stay that way. Using your creams and whatever, it will just stay like that. It will just stop getting any worse. It just won't get any worse. It will just stay really looking horrible and patchy and waxy and horrible, and it won't get any worse than that without any treatment at all. You won't, even without treatment, it won't get any worse at all. It will just stay like that, So it's the most common and the most mild, realistically speaking, with this condition. Then we get to the diffused scleroderma, which affects most of your body and some of your organs. So this can affect your digestive tract and your lungs, and can possibly give you kidney failure. If it's really severe, it has been known to be kind of life-threatening. If the pulmonary effusion becomes really severe, it can become life-threatening. This one is the most severe, one of the most severe. So yeah, this one is if you get this one, you're going to be in a lot of trouble. You're, realistically speaking, your life will change not for the better. But if you get the limited scleroderma, it will also be known as something called CREST syndrome, because each letter of the CREST has its own name. So CREST, there's a name for each one of them, or there's a word for each one of them. They each have their own symptom attached to it, and I can't pronounce half of them. But here we go. C. Calcinosis. CALCINOSIS. Calcinosis, which is an abnormal calcium deposit in the skin, right? I know this one. R is for Raynaud's phenomenon, which they tell you to see the symptoms section, which is fine. That doesn't tell you a lot anyway. It's difficulty swallowing, it's to do with. Well, it's not. Raynaud's syndrome. Raynaud's phenomenon. Raynaud's can affect everything. It affects your lungs. It can affect your heart. Raynaud's is a weird one. It's not nice, and I'm going to have a proper look at Raynaud's properly, so I know what I'm doing. But it just tells you to see the symptoms section, and the symptoms section just doesn't really explain anything. But I know Raynaud's does affect a lot of things, but it's very much a blood vessel thing, and can affect your heart, and So, and then you have things like E for the esophageal dysmotily, if that's right, and that is the difficulty swallowing, because that's there. And then you have the S. That's the sclerodactyly, which is the skin tightening on the fingers. Now this I don't even think this is a word. I really don't think this is a word. They made this one up, I'm pretty sure. TELANGELCTASIAS. I can't pronounce that. I have no idea what it is, and I'm pretty sure they made that word up. And it's red, and what it means is red spots on the skin. I am pretty damn sure they made that word up. That simple. So yeah, don't care, they made that word up. So yeah, but yeah, it's normal for people to get skin thickening on fingers, the hands and arms and feet and things, but the digestive issues are only in your esophagus, and then it can progress into the pulmonary hypertension, but it is only 20 to 30% where it gets life-threatening. So yeah, I would go through this list of symptoms, but we're nearly at 20 minutes, and I might just, and then I'll leave it there and do the diagnosis and that afterwards. So the symptoms we list, they are thickening skin, the red spots on the skin, I am not saying that ridiculous word, excessive calcium deposits on the skin, joint contractions or contractors, rigidity, I like that, tight or mask-like facial skin, ulcerations on the fingertips and toes, pain and stiffness in the joint, persistent cough, shortness of breath, heartburn, difficulty swallowing, digestive and gastrointestinal problems, constipation, weight loss, fatigue, hair loss, and then they mention things like the Raynaud's phenomenon and the Sjögren's syndrome, which, they then mention the statistics about the Sjögren's being in 20% of scleroderma and the Raynaud's phenomenon occurring in 10% of people with scleroderma. because Raynaud's phenomenon is something a lot of, like 85 to 90%, 95 people can actually experience anyway on their own. So yeah, it's a normal. A lot of people do experience Raynaud's without even knowing it. I have a mild version of Raynaud's in my hands. Raynaud's affects your blood vessels. It's the flow of blood in your body. And there it converts from an exceptionally mild version of Raynaud's where it's just in your hands to where it affects your entire body. I get it in my hands where my fingers, they turn blue and my feet turn blue. It's if my hands get cold, or my hands get cold a lot and my fingertips, they turn blue. So do my feet. I was told couple of years ago that I have Raynaud's syndrome. I have Raynaud's syndrome, which is the exceptionally mild version of Raynaud's phenomenon. I know someone who has not quite Raynaud's phenomenon, but has Raynaud's, but it's a little bit more severe than mine because his goes right up his arms, he shakes, he has a lot of issues. He has Raynaud's. I can't remember which one he's got, but it's more severe than mine, but it's not quite Raynaud's phenomenon. So Raynaud's differs and has a lot of different types to it. I have the mildest version where I just go a bit blue. He's got it so he shakes, everything goes blue, he loses the ability to use his hands and his arms. It's not nice. It's really not nice. But the most severe is Raynaud's phenomenon, and that affects, because it affects all of the blood vessels and everything else, it affects your heart and of course then your breathing. So yeah, that's what they're talking about. Yeah, anyway, I'm gonna go, I get it sorted, and I shall see you all later. Bye.